Right now, we're in my new apartment. There's nothing better than having your own. You can say, this is mine. I pay the bills, I pay the rent. No, I pay to stay here. I pay the cost to be the boss.
Leroy's story is one of health and hope. It's of medical care delivered through an innovative system, coordinating and connecting provider partners that closes gaps in the safety net to meet multiple needs. Those needs can be seen through his experience.
When I was homeless, I was from like doorway to doorway, freeway underpass to freeway underpass. No. Now, if it's cold outside, I just come inside and close the door.
We met Leroy at Project Roomkey, Alameda County's temporary housing hotels, where Care Connect partners served residents during the COVID-19 pandemic.
I used to own my own home. I used to work for the state of California. I was assistant director for State Compensation Insurance Fund in the data processing department. Well, my parents owned the home, and when they passed away, by me being an only child, they left the house to me. So when I put in for a loan to have the house brought up to code, they said that I owed back taxes because my father he had a GI exemption, and I wasn't eligible for the GI exemption. So I owed all these back taxes that I couldn't afford to pay. And then they started coming up with things, $800 to have the sidewalk repaired in front of my house. I had to pay another couple of $1,000s, and if I couldn't pay it, they added it onto my taxes. And then they put a lien against the house, so I ended up selling the house dirt cheap just to keep the city from taking it from me. And that's how I became homeless.
So through dynamics Leroy could not overcome alone, he lost the home he knew. He came to learn it's very difficult to maintain health and safety when you are unsheltered. The experience was life-changing, including the way medical professionals responded to him.
I went to the emergency room and it was real cold out, and they thought that I just wanted to come in to get in out of the rain and out of the cold. And that wasn't the case. I was coming in because I was actually in pain and could barely walk. Security threatened to call the police on me if I didn't leave. I said, well, call them. I can't go anywhere. A few minutes later, another doctor come running out and said, where's Leroy at? They said, he's sitting over there. And he said, I'm so glad you didn't let him leave because I saw something on his x-ray. He's going to be staying with us for a few days.
Leroy Morgan, very nice guy. He had some medical issues. When you're living on the streets, it may not be possible for you to truly take care of yourself the way that you should. You know, you hear stories like their medicines being stolen, all their belongings being stolen, being beat up, just different hardships in their life. So it is difficult.
Cynthia is a Project Roomkey nurse who supported Leroy.
So that's why this program, taking them off the street and giving them a safe place to call their own, has been great.
During his stay at Project Roomkey, partner providers created a care plan for Leroy. Along with it came the community health record, developed through Alameda County's Healthcare Services Agency, which made it possible to coordinate and deliver the services Leroy needed to transition from the street.
The problem the CHR was designed to solve for is the fact that the folks we serve oftentimes receive care from numerous community-based sources, right? They go to one clinic, they're seen in another, in an emergency room, in an urgent care, they have a psychiatric provider, they may seek substance use disorder counseling, but each of those sources of care has little idea of what the others may be doing. And so the CHR brings that all into a central platform. It's like turning the lights on to be able to see the totality of care that is available to a given individual. Having that information available allows us to really respond successfully to the needs that we identify.
Leroy's individualized care plan helps Cynthia plan for continuity in his medical care for the first time in years.
When I got to the Radisson Hotel, they wanted me to switch over to a senior citizen facility, but then they told me I would have to change doctors and have to start all over again.
We advocated for him when there was issues.
I love my doctor. My doctor knows more about me than I know about myself.
He took care of his medication. He went to his own doctor's appointments.
Oh, the nurses were, lovely.
We got it resolved, and I told him if he had any other issues to let me know.
Services and support delivered through Care Connect provider partners created the circle of support needed for Leroy to stabilize his life and plan for his future.
I've been here since the first part of April. It makes me feel a lot more comfortable, except for the fact that, I don't know exactly how long I'm gonna be here.
Housing problem solving is one of the key supports that Care Connect partners provide. Getting housing ready for a permanent home requires multiple documents that can be difficult to obtain when living on the streets without transportation, an address, or driver's license. Having temporary shelter like Project Roomkey allowed Leroy's providers to stay in contact as they stabilized his health and prepared him for transition. The Community Health Record and Care Plan allowed multiple providers to monitor daily progress, close gaps, and prepare Leroy for permanent housing. And that's a story you'll learn about in Leroy's home.